we're now going to take a look at the spinal nerves. So when you take a look at the spinal cord, which I've drawn up here on the left, there's a couple of things. Firstly, the spinal cord has a whole bunch of nerves that shoot out and away and come back into it. And it actually happens either side of the spinal cord, but I've only drawn it up happening on one side here just for simplicity's sake. So even though I've drawn all these lines coming out, each line is representative of a spinal nerve, please know that it's happening either side. That's the first important point. So a couple of things. We can actually separate the spinal cord out into various regions or segments. And what you find is that this first upper section we call the cervical region. Then we've got the thoracic. Then we have the lumbar, sacral, and then coccygeal, right down the bottom. And what we find, if we count the amount of nerve pairs in each one, you'll find that the cervical has 8, the thoracic has 12 nerve pairs, the lumbar has 5, the sacral has 5, and the coccygeal has 1. What this means is that there's 31 pairs of spinal nerves. 31 pairs. Now the question may be, how are you supposed to remember those? The way I remember it is, what time do older people tend to eat during the day? They like to eat at 8 a.m., 12 p.m. and 5 p.m. And then you can just remember 5 and 1. Now what I want to do is I want to go through these nerves and highlight some important points and highlight some of the most important nerves that you need to be aware of clinically. So we're not going to go through every nerve and name them and where they go and what they do, but some of the more important ones. So first thing that you should be aware of is some of these nerves will come together and form a braiding. You know when you braid your hair and you can have all the individual strands of hair come together to form what looks like a big clump of hair, and then it sprays or splays back out at the other end. We actually call that a plexus in biology. When a nerve, when discrete nerves come together and then branch back apart again. I'll show you what I mean right now. So firstly, if you were to take the first 4 cervical nerves, so let's do it. We'll take 1, 2, 3, and 4, take those first 4 cervical nerves, they actually come together to form this braiding that we call a plexus. And then they actually branch back out again. Now your question may be, why would nerves form a plexus? It makes no sense. Well, think about it. Sometimes these nerves need to go through very small compartments. So the neck, the shoulder or the arm, the hips and the waist and the legs. So they need to sort of go from being discrete nerves, and they need to come back together to move through these smaller compartments. So C1, C2, C3 and C4 actually form something called the cervical plexus. So this is called the cervical plexus. And the cervical plexus is really important for a couple of reasons. What does it do? Well, it innervates the back of the head. It innervates the neck and innervates the shoulders. Both sensory and motor. So it picks up information about what's happening in these areas and sends it to the brain, but also sends signals out from the brain to tell them what to do. So tell them to move, for example. So C1 to C4. C1 to C4 is that cervical plexus. So if I were to take C3, C4, and C5, this is important because what these nerves do, C3, C4, C5, they go to a very special muscle called the diaphragm. And the diaphragm is the muscle of the lungs and allows for us to breathe. Together, these nerves are termed the phrenic nerve. So the phrenic nerve, I'll I'll get rid of this. I'll write it in a sec. The phrenic nerve innervates the diaphragm and tells the diaphragm to contract, allowing us to breathe. And that's obviously important. Without breathing, no survival. So we often say C3, C4, C5 keeps us alive. C3, C4, C5 keeps us alive. So there's some important nerves of the cervical area. Let's now move a bit further down, because you can actually have some cervical nerves and some thoracic nerves come together to form another plexus. So if we were to take C5, C6, C7, C8 and T1. So let's do that. C5, C6, C7, C8 and T1, and bring it all together. It forms another plexus called the brachial plexus. And so they branch back out again, remember? So let's write this down, the brachial plexus. So the brachial plexus actually goes to the arm. So we've spoken about we've spoken about the cervical plexus, now the brachial plexus, and that innervates the arm. And there's a couple of nerves you should know from the brachial plexus. That is the median nerve, that is the radial nerve, and that is the ulnar nerve. So the median nerve goes straight down the middle, innervates the middle part of the hand. The radial nerve is important because its ability to move the thumb, for example, and the ulnar nerve is its ability to innervate the pinky finger. When you hit that funny bone and you get the tingling go down your arm into your lateral aspect of your hand and your pinky finger, or I should say the more medial hand and the pinky finger, that is the ulnar nerve. So median down the middle, radial towards the thumb side, which is more lateral, and the ulnar, which is more medial and goes to the pinky finger. So they're the nerves that you need to remember of the brachial plexus. Now there's no plexus of the thoracic nerves. Why? Why is there no plexus here? Because there are no small cavities it needs to move through. The nerves of the thoracic area actually innervate the muscles of the intercostals. So the intercostal muscles, intercostals, chest, and back, and abdomen as well. So think all of that thoracic area, right? You've got the chest, you've got the abdomen, so your tummy, you've got your back, and you've also got the intercostal muscles as well. They're the muscles between the ribs. That's what intercostal means, between the ribs. So there's no plexus here. And then if we move down to lumbar, let's have a look. We've actually got a lumbar plexus from L1 to L4. So L1, L2, L3, L4. They come together to form a plexus. The lumbar plexus. And so the lumbar plexus innervates the thigh, which is very important. The anterior, the medial, and the lateral aspect. So anterior means front, medial means middle, and lateral means side. What have we missed? The back. So the nerves of the lumbar plexus actually don't innervate the back of the thigh, just the front, medial, and lateral. And the nerve that you should know that does this is the femoral nerve. So the femoral nerve comes from the lumbar plexus. And then finally, the last plexus you need to be aware of is that of the sacral plexus. And this actually goes from L4 to S4. So we've got L4, L5, S1, S2, S3, S4. And this is what we term the sacral plexus. Sacral plexus. And the sacral plexus does the back of the thigh, right? So the posterior aspect of the thigh and everything below the knee, So, the posterior thigh and pretty much everything below the knee. And the nerve that does this is the sciatic nerve. This is the one that a lot of people tend to impinge or injure, and then they've got a whole bunch of problems with pain in their bum. So they get pain that shoots from their back down into their bum. So think about the sacral plexus. Innervates your bum, so your glutes, the posterior back of your thigh, and everything below your knee. So problem with this nerve can alter the way that you walk, and it can lead to foot drop, which means every time you lift that leg, the foot doesn't lift up, it just drops down. So what have we learned here? Well, there's a couple of plexuses, the cervical, the brachial, the lumbar, and the sacral. They form a plexus to get through narrow openings, so narrow regions or compartments of the body. And you can see they're made up of various nerves. The important nerves that you need to be aware of each one includes that of the phrenic nerve, the median, the radial, the ulnar, the femoral, and the sciatic.